Monkey poster lagi daw.
This meeting is being recorded.
Sir, shall we start now?
Yeah,
Because
I think
participants has joined already.
yeah, we can start.
Okay.
Please go start and meanwhile, if you have any queries related to this topic, if you have any question, you can ask freely in the comment section.
A very good evening, everyone. I am Donna from Clarinet. Clarinet is very proud to be a part of this webinar. Clarinet is India's largest digital CME and doctor-generated learning platform. Here I am presenting a short video on Clarinet.
We are very proud to be a part of this webinar.
Now I am handing over the session to Dr. Venkatesh from the National IMA JDN Standing Committee.
Thank you so much. Very good evening, everyone. I'm Dr. Venkatesh Karthikeyan, MD Community and Family Medicine Postgraduate Resident from AIIMS Patna. I'm glad to see that more than 350 medical students and doctors from lengths and breadths of the world have registered in today's webinar. In the past year, IMA Junior Doctors Network has organized a series of webinars for the benefit of our junior doctors. In recent times, we have collaborated with the Ministry of Health and Family Welfare, AIIMS Delhi, AIIMS Patna, IAPSM, KAHO, Star Health Insurance, Max Group of Hospital, Tata Memorial Hospital, and with many national and international faculties. We have got excellent feedback that our webinars are very useful for young doctors, and hence we are continuing our webinar series. As an MBBS student, I was always fascinated by emergency medicine. I used to spend at least 1 hour every night in casualty right from my second year of MBBS. Emergency medicine is one of the branches which gives us an adrenaline rush all the time, and we can definitely say without any doubt that emergency medicine is the noblest of this noble profession. Many MBBS students and young doctors having love towards emergency medicine, but there are several questions in their mind, like what is the scope of emergency medicine in India? After doing my PG, what is the scope? Can I go abroad? Can I have a private practice? Will I get a good job? Will I be able to make a good living? Etc. etc. The Indian Medical Association Junior Doctors Network is organizing this webinar on this World Emergency Day to answer all your questions. I would like to thank our National President, Dr. Satanand sir, our HSG Dr. Lele sir, our JDN Chairman, Dr. Srijit sir, Dr. Parul ma'am, and other senior leaders of IMA for giving us an opportunity to conduct this session. We have wonderful speakers like Dr. Shweta Tyagi ma'am from SEMI Maharashtra, Dr. Sandeep Gore sir from Fortis Mumbai, Dr. Dina Shah ma'am from Yatat Group of Hospitals, Dr. Harshal Mehta sir from Ahmedabad, and our moderator Dr. Rimi ma'am, who herself is an emergency medicine trainee. Professor Dr. Tamorish Kole sir and Dr. Narendranath Jena sir, who are supposed to join today, had got some last-minute commitment. However, they have sent a video message for us. So I believe the next 1 hour is going to be a wonderful treat for all of us. Without any further delay, I would like to request Dr. Rimi ma'am from IMA JDN Committee Chair for Postgraduate Studies to take over the session. Over to you, ma'am.
Thank you very much, Dr. Venkatesh. On this wonderful occasion of World Emergency Medicine Day, today, that is on May 27, 2022, we've all gathered together to celebrate this day as well as highlight some of the key points as to why emergency medicine is a specialty which needs more importance as far as government policies are concerned. Emergency medicine was recognized as a specialty in our country only as late as 2009, and hence it's still in its infancy stage, we can say in context of India. So today we are going to talk about what is the scope and the potential and impact of that emergency medicine has in context of India. We have a very august presence of very stalwarts in the field of emergency medicine in India. So I would like to welcome all of the speakers, of our respected speakers, to our today's webinar. sent us a recorded video message, which gives us the message that he wants to put across. So Damorish Kole sir, he's the visiting professor in the University of South Wales in UK, an advisor for emergency care training at Healthcare Sector Skills Sector Council of India. He's also been the past president of SEMI and the chair of Disaster Medicine Special Interest Group at IFEM. Our second honorable speaker will be Dr. Narendranath Jena sir. He's the director and head and the Institute of Emergency Medicine, Meenakshi Mission Hospital and Research Center, Madurai. He's also the president of the Indian College of Emergency Medicine, the Indian Society of Toxicology. Our third speaker is Dr. Shweta Tyagi ma'am. She's a senior consultant at Paras Hospitals, and she's also the president of SEMI Maharashtra. Our fourth speaker today will be Dr. Sandeep Gore sir. He's the director at emergency medicine at Fortis Hospitals. He's also the vice president of West Zone of Society of Emergency Medicine India, SEMI. Our fifth speaker tonight is Dr. Deena Shah ma'am. She is the group head of emergency medicine at the Yathard Group of Hospitals. And our sixth speaker today is Dr. Harshil Mehta sir, who is the MD in emergency medicine and the zonal head at Marengo Sims Hospital, Ahmedabad. I am Dr. Rimide, who will be your moderator for the night. I am an emergency medicine trainee at Paras Hospitals, and I am the committee chair at Postgraduate Studies and Indian Medical Association Junior Doctors Network. And you've already met our host for the night, who is Dr. Venkatesh Karthikeyan. So without much ado, let's start with our proceedings for the night. Now that I've introduced the speakers, I would want someone from the tech team to be playing the recorded video message that we have from the end of Dr. Professor Damorish Kole sir.
Hello everyone, good evening. First of all, wish you all a very happy Emergency Medicine Day. Today is 27th May 2022, and this year is very, very significant for emergency medicine because after COVID, this is the first time we are recouping and revamping back to our full strength of emergency care. During COVID, we have experienced the real challenge of healthcare, and we were the front line of front lines. Today, I'm going to talk to you about the past, present, and future prospect of emergency medicine in India. As we all know, that emergency medicine is a new specialty in the house of medicine. 60 years back, there was no emergency medicine. There was only accident and emergency care, which mainly arrived from military medicine. And then a couple of doctors and healthcare professionals started this specialty in United Kingdom, and similarly, emergency medicine progressed all around the world. Indian emergency medicine started to take shape around the year 1998-1999. And during the next 3 years, which is by 2002, the first emergency medicine international conference was organized in India, in the city of Hyderabad, and the Society for Emergency Medicine took its shape. And thereafter, the emergency medicine progressed to the present day. Now, as any country, emergency medicine first started by individuals who were interested to provide emergency care, and then started to form professional organizations like Society for Emergency Medicine in India. And then came the recognition of the specialty of emergency medicine by Medical Council of India in 2009. And that was one of the landmark event in our nation, because post that, the emergency medicine progress as far as the academic development of the departments and systems started to take the proper shape. Thereafter, in 2013, the National Board of Examinations recognized emergency medicine as an important training. And today we have MD and DMB in emergency medicine. We also have bilateral programs inside and out from outside of the country, which are for capacity building in emergency care. And in this journey, the various specialist colleges and universities from the West has really helped us to develop the specialty. Now, as far as young minds are concerned, and as far as the new generation is concerned, the main question today arises, what is emergency medicine? Why should I take up emergency medicine? And how is the future of emergency medicine look like? So I'm going to concentrate on these three important topics because I really feel that a lot of youngsters need to take up this specialty to provide emergency care to 1.3 billion populations and growing. Now, coming back to the first question of what is emergency medicine? Emergency medicine is a set of knowledge and competencies which is required to treat undifferentiated patients, be it in acute condition, be it in a chronic conditions, and then a regular visitor, or be it for anything else. We must remember, although emergency medicine is a specialty, emergency is a term which is a perception of the general public by which they sense that something is going wrong and they run to us. And that perception is very much personal as well as not differentiated by the boundaries of medicine. So sometimes we see there are patients who need not to be in emergency, just come to and visit us to allay their fears and reduce their anxiety and so on and so forth. So emergency medicine is a vast area of practice, and the scope of emergency medicine lies within every specialty. One very important definition of emergency medicine, which I like, is that emergency medicine is the first interesting 10 minutes of every specialties of medicine. And that is how I would like to see emergency medicine. The second question which comes is, why do I need to take emergency medicine or pursue the career of emergency medicine or become an emergency physician when there are so many other choices to become a specialist in every other specialty? The answer lies, and the fact remains, that the emergency medicine is a specialty where there are lot of I would say adventure. There are a lot of unexpected happening. There are a lot of challenges, but there are a lot of rewards and recognition. So I would like to compare pursuing emergency medicine as conquering a summit. For example, the summit of Mount Everest. Now, if we need to pursue this journey of conquering Mount Everest, the first thing is we need to make up our mind of adventure. So the first thing, when you try to choose emergency medicine, please understand that you are entering in a specialty of uncertainty, and you need to have an adventurous mind to accept this challenge. The second thing which happens in the life of mountaineers is when they go up to a summit like Mount Everest, they don't climb directly. They go to a base camp and they do conditioning, they do acclimatization, they take lessons, and then they start. Likewise, when you enter into emergency medicine, you need to condition or acclimatize yourself, because this is quite a different from other practice of specialties. So have that time, give yourself that time, and acclimatize yourself in this area of uncertainty. The next thing is, of course, whenever people climb such mountain, they make up a team. So team dynamics is one of the very, very crucial factor in the practice of emergency medicine. We don't practice alone. We have nurses, we have colleagues, senior colleagues, junior colleagues, other specialists, all of us make a team. So emergency medicine is really a team specialty. So that's the second. Next comes climbing up to the summit. When you climb up to the summit, you don't go directly again on one journey. You go up to a distance, you take up the challenge, and then you take rest, you take your lessons, guidance, and then you move forward. Likewise, in emergency medicine, you need to have guides in place. You need to take up the career in bits and pieces. For example, for early career, you need to do a set of activities. For mid-career, you need to carry out different set of activities. And for continuation of career, you need to carry out certain activities. And these are milestones which are very, very important. And don't forget, it's a matter of lifelong learning, like any other specialty in medicine. Finally, when you go up to the summit or you reach your destination, you achieve a great joy, and you also embrace safety, because when you achieve greater height, you need to have safety. So think of the life and work balance, think of burnout, think of taking mentorship, and also think of continuous learning. These four elements are very, very important in emergency medicine. Now, coming to the future of emergency medicine, where are we leading to as far as our country is concerned? I would like to cite a report by the Niti Aayog, which is the important arm of the government of India, which analyzed the situation of emergency care delivery in India in 2021. And not surprisingly, the report depicts the lack of adequate manpower, the lack of adequate beds, and lack of adequate facility when providing emergency care in and across the country. And this is not a new finding. This is a continuous realization of all of us who are into the field of emergency medicine. Now, question arises whether we expect government to do all this, or do we have any role to play? I strongly believe that we all individually have definite role to play in terms of training others, in terms of advocating for more infrastructure, more facilities, and providing the best care for every patient that walks in our door. If you all get united, if you all want our patient gets best care, irrespective of place, irrespective of time, irrespective of us, everybody should get the same level of care in this country. And then that can convert into a movement, and over the period of say 5 years, 10 years, we can achieve a great deal of emergency, best emergency care in this country. Lastly, I would say that the future of emergency care lies not in the emergency department, but outside the emergency department. You need to invest your time, or we all need to focus, our effort, our strategy for better care outside hospital as well, be it as a home, be it community, be it pre-hospital care, be it inside the ambulance. We have a great deal of effort which we all need to undertake. And in this, don't forget, my friends, technology is going to play a pivotal role. So embrace technology, learn digital skills, and enjoy emergency medicine. Once again, wish you all a very, very happy Emergency Medicine Day. Thank you.
Thank you, Dr. Professor Tamarish Kole, sir, for such enlightening words. Now we'll move on to our speakers who are present with us. So today's first question will be to Dr. Sandeep Gore, sir, regarding what is the relevance of emergency medicine and the need of trained emergency medicine professionals and well-equipped emergency departments, especially in the context of India. Over to you, sir.
Okay. Emergency medicine departments play a very pivotal role in any healthcare delivery systems. You can now we can see in India, we can see there are lots of private tertiary healthcare center, as well as in government sector also there are tertiary healthcare centers. And for a patient, suppose any emergency happens, suppose somebody has a chest pain, so somebody has sudden weakness of one side of the body, or somebody has a trauma, what is the hospital for them? The emergency departments are the hospitals for them. So at the time, when these patients reach to the emergency department, based upon the patient's conditions, if patient is hemodynamically unstable, that patient requires a resuscitation. And after that, you require to do the proper diagnosis of the patient. Suppose a patient having a chest pain, then doctor has to do the ECG and he has to diagnose the condition. If it is ST segment elevation, myocardial infarction, then emergency doctor has to facilitate the patient for the primary angioplasty. Suppose a patient presented to emergency department with one side of weakness, it's a stroke. Within 3 hours, if the patient reaches to the emergency department, then by doing the imaging, we can thrombolize the patient and we can reduce the neurological deficit of that particular patient. Same applications to the, you all know about the golden hour of the trauma. If a polytrauma cases come to the emergency department, they have to do the resuscitation, proper imaging, and right intervention at right time that can be life-saving for the patient. Suppose simple things in polytrauma can save life, such as if pneumothorax is there, needle thoracostomy followed by tube thoracostomy can save the life. And suppose a patient having patient is hemodynamically unstable, then we have to research the patient and we have to shift the patient to the operation theater. To accurate judgment of the patient condition and resuscitation is very important. Many times patients present to emergency department in undifferentiated way, undifferentiated breathing difficulty, undifferentiated shock. So accurate diagnosis of that breathing difficulty is very important. That is the role of emergency department. A breathing difficulty can be acute asthma attack, it can be the interstitial lung disease, it can be a severe dangerous thing like a pulmonary embolism. It can be so there are varied reasons for this. The emergency department doctor has to use his clinical skill as well as his diagnostic facility which are available in emergency department and diagnose the patient rightly. If the right diagnosis happens at the right time, then right treatment will be happen and patient's outcome will be, of course, it will be the great. So to do these things, to all these things, we require 3 things. One, you required well-trained manpower. You can build buildings, you can bring the equipments, but where you bring the manpower which will utilize the clinical acumen, which will utilize clinical skills to diagnose and treat these things. So emergency medicine manpower is of paramount importance, and unfortunately our country is far lag behind as compared to the developed countries like I can say the Canada, UK, USA and Singapore. As compared to these developed countries, the trained emergency medicine doctors are less than 5% also the requirement. So as a country, you have to work very hard to build the trained emergency medicine doctors across the country. Then these emergency medicine doctors will requires well-equipped infrastructure and emergency medicine department. So infrastructure comes to proper place. Some 5 to 10% beds of every hospital should be dedicated to emergency department. Emergency department should have all monitors and ventilatory facilities. It should have a point of care testing lab. It should have a point of care ultrasound availability. And with these things, with skilled manpower and with this infrastructure, then emergency physician can able to resuscitate the patient at its best, and he can come to right diagnosis from the all undifferentiated patient. And of course, when right diagnosis happens, then right intervention will happen, and patient outcome will be the good. So I can say the emergency department is the throbbing heart of the hospital in any organization. A good emergency medicine department has a huge impact on mortality as well as morbidity of the patient. It will reduce the mortality also and morbidity. You will ask me how? A good resuscitation in emergency department, you can say that stitch in time can save 9. So a good resuscitation can be life-saving. And if you diagnose the underlying condition properly, any undifferentiated abdominal pain, severe abdominal pain, it can be aortic dissection or aortic aneurysm. If you pick that aortic aneurysm in emergency department, that patient will be treated accordingly and he will be saved. A breathing difficulty patient, I can see very frequently pulmonary embolism cases in emergency departments, but the diagnosis will happen only trained emergency medicine doctors who are dedicated for this particular field are available in emergency department for the round the clock, and provided they are well equipped with proper infrastructure and equipments. So one single line is that emergency department is indispensable part of any modern healthcare facility, and they represent the ethos of the institute. And what happens in emergency department, department gives long-term impact on patients' outcomes. So emergency department is, I can say, the most important specialty in any organization and in our country also. And I don't have any doubt in quoting these things. And as a country, we have to travel a lot. We have to work on 2 to 3 places. Here we have to build tremendous manpower, doctors to be trained, nurses to be trained, and of course we can see the good infrastructure in private health sector. Similar type of infrastructure we require in all civil hospitals, rural hospitals, in all government facilities. And of course, the pre-hospital medical service is, which is the integral part of emergency medicine, that we have to need. So if we work on this thing as a collective, as a nation, then I'm confident that in next few years, I think India will lead entire world for emergency care benchmarks.
Thank you, sir. Thanks a lot for emphasizing and reiterating upon the fact how the importance of a well-trained emergency medicine professionals, as well as well-equipped, state-of-the-art, latest technology-laced emergency medicine departments in context of India. Now, moving on to our next speaker, our question to Dr. Shweta Tyagi ma'am is, what is the scope of emergency medicine and what are the expectations out of an emergency physician and what do we actually do? Over to you, ma'am.
Thank you, Remy. So before I start, I would like to wish everybody a very happy Emergency Medicine Day, to all the doctors who are out there and the emergency physicians in particular. And especially so, it all became very relevant in the COVID pandemic, which I think all of us have understood it very clearly. Now, coming to this question, as what is the scope of emergency medicine and what we do as emergency physicians. So I would like to say it like the most important line here would be that right to live and to get emergency medical care is like one of the most fundamental rights for any human being. And emergency department and emergency physicians, I mean, nothing can be more rewarding than saving the life of an individual. So you are the ones who are basically sitting and pulling the patient out of the fence. The patient is on the fence, life and death, right? Most of your patients would come in that scenario. As Dr. Sandeep said, patients come to us in an undifferentiated state. They might come breathless, they might come in shock, they might come in polytrauma situation. Now, an organized and a systematic approach to these patients can be life-saving, especially in the golden hour. That is your 1 hour period after suffering from that acute injury or that serious medical condition, like it might be acute stroke, where door to needle time becomes so critical. Your door to needle time has to be within 60 minutes. So you as emergency physician in the department, identifying the stroke, fast tracking these patients and getting those times done as early as possible will actually create the difference in both morbidity and mortality of the patient. So what do I do as emergency physicians, or what we all do as emergency physicians are, we resuscitate patients, may it be polytrauma. So how rewarding it can be when a patient comes to you with shock, where we don't know what is the cause. You do an ultrasound fast focus in the department and find that the patient has got free fluid in the splenorenal angle. And that's when your diagnosis of the splenic rupture or injury happens. And if this patient gets fast tracked to the OT immediately, that is what saves the life of the patient. So these are the things which are the most rewarding in emergency medicine. So as Dr. Tamarish also said, it actually accounts for the first 10 to 15 interesting minutes of each specialty. So that is the scope of emergency medicine. And what are the expectations from us? So basically, we treat anything and everything. I'm sure everybody who works in the emergency department has, seen a wide spectrum of patients ranging from somebody who is so critically ill to somebody who has come just with an avulsion of toenail. So everything with all varied ranges of criticality are seen in the emergency department, and we have to be sort of, jack of all trades, but at the same time, master of time. So we are the timekeepers, and our timekeeping actually makes that difference of life and death for the patient. So that's what I would want to say.
Thank you, ma'am. Thank you for giving us a picture as to what we are expected to do and how we cater to it relentlessly round the clock, because we are catering to every sort of medical emergency as well as the most vague of signs and symptomatology at any hour of the around the clock. So that is what we are expected to do, and we are doing. So thank you, ma'am. So our next question will be to Dr. Deena Shah, ma'am. And the question is, how essential is emergency medicine in bringing an impactful change in the entire healthcare delivery scenario in our country? Over to you, ma'am.
Good evening, everybody. And I guess majority of the stuff has been discussed. So I would like to put my camera on various other parts. As a ER, we don't only see the STEMI, stroke, trauma. We see a lot other things as well, which are very fragile kind of group of people. Neonates come in, newborn coming in, pediatric patient coming in with seizure, where the family is stressed. We see the elderly coming in with undifferentiated unconsciousness, and we deal with every single group, age group in the community. Along with that, we deal with serious illnesses like oncology patient who are on treatment, very fragile, very delicate, and they've got only moments of time. Everyone is anxious, including our own oncology and radiation therapist and everyone. And if they actually walk in and say that, if you guys are not there, we don't know how we can manage. When the patient reaches us, we feel that they will be dead. Without that, we cannot make any outcome in our oncology or pediatrics or neonatology. So yes, major things are there. The STEMI and all, very popular. Time-bound treatment. We can call it golden hour or platinum minutes or whatever it is. But we do make difference in every single area of life. That's how I look at it. And not to forget the retrieval services, which we are part of it as well. It is a part and parcel of emergency department where we dispatch the ambulances to the place at right time, right place, right person to come in with. And en route care also we provide. As soon as they arrive, we are ready with whatever the person needs. So lots of things are part and parcel of our care. We've got lots of facets as an ER as well. The good communication skill also will make a lot of difference in impact in outcome, because the way we assess, the way we communicate with inpatient unit, they speed up. Like if we are having the patient with difficult intubation in emergency room, we can get down anyone whosoever is available. They can rush in with fiber optic bronchoscope or video assisted scope. Nowadays we are using it because of the COVID. We are the only one who are handling everything. But all the inpatient units are also aware that we deal with unknown anytime, anywhere. Not to forget what we deal with is a mass casualties, major disasters, where we are part of it as well. So yes, we make and real good impact in outcome of any delivery of care at any moment of time in our services of healthcare providers. As a healthcare provider, we can be the key person between the inpatient unit and the community. So that's how I would like to put it to your question, Remy. I hope I made myself clear, and wish you all a very happy emergency day.
Thank you, ma'am. Yes, you did make us very clear regarding this point. So before I move on to the next speaker and ask the next question, I would like to also make it a point here that at the end of the discussion, we'll be taking up questions from the audience. So just in case anyone has any queries to any of our speakers, you can put it in the chat box, and at the end of the session, we'll revert back to those questions. So my next question will be to Dr. Harshal Mehta, sir. And this question is a very importance to us, all the residents and all the interns who are thinking of pursuing emergency medicine as a field of specialization. So the question is, what are the job prospects for a trained emergency medicine physician? And what more needs to be done to upgrade the status of emergency medicine physicians in our country? Over to you, sir. Sir, you're muted. Probably you'll have to unmute.
Sorry. So first of all, very happy Emergency Medicine Day to you and everyone. The question is basically time. It's a very important question, and what you see. I'll tell you my story. I took the MD Emergency Medicine seat when it was first time MC recognized seat open in any college in India. So I did from Ahmedabad BJ Medical College, where it was the first time. And when I was standing in the queue and I saw that one seat is there for MD Emergency Medicine, I asked my friends, my seniors, my parents that what should I do? Should I go for it or not? So everybody was blank. I mean, it was the first time, nobody knew much about that. And because of my gut feeling, I thought it's okay, let's take it. We'll see what can be done later on. But currently I am taking it. And that's how I took the branch and finished my 3 years. After 3 years, again, I was blank as I was the first one to clear MD. And I was not clear what to do, whether to go to UK, that was the trend, whether to pursue the emergency medicine only, whether to take as a physician and go for physician practice, or should I go for critical care? Again, I thought that what can be done, and my gut feeling said, no, stay in emergency medicine only. So I stayed in emergency medicine. I went to Mumbai from Ahmedabad. I stayed there for 3 years, took some experience, and then came back. And now I am in this position. So first lesson that I learned from my career is that never give up. See, you will hear a lot of good things, a lot of bad things, but never give up. It's a branch that will shine and that has started to shine, and that will shine for sure. Each and every hospital is having emergency medicine department, and it is the face of any hospital. So now in corporates, I see that everybody is eager to hire a trained emergency physician because they don't want to lose any patient from emergency. Even consultants are not available when it is the time of emergency. Then we are treating the patients. We are the owner of the patient and we save them. So hospitals now have understood that emergency medicine department has to be proper functional with trained staff, trained doctors, trained nursing staff, and everything. In government, now government has also said that to get any MBBS or MD seat, you need to have emergency medicine department with proper professionals. So they are also in the process of having proper emergency physicians. And the way to go into the government colleges are to have a senior residency of 1 year, then assistant professor, then associate professor, and then professor. So initially we had a lot of struggle to get into recognition, but now everybody has understood that emergency medicine is an important branch to have it, and it is the face of the hospital. And now they have understood that emergency medicine is not, it may not be a revenue generating branch, but it is a quality driven branch. So quality that is required in today's era, and because of that requirement of quality, we are there, and because of that, the chances of having jobs, the chances of emergency physician to be recognized is very high, and year by year, day by day, it is now increasing. So even if you are in emergency medicine or you are thinking to get into emergency medicine, there are bright scopes. And you should not lose any chance to get into the emergency medicine branch because of you hear that it is not a good branch or the future is not so bright. It is bright. There are few, what you can say, restrictions that you cannot, or it is very difficult to run an OPD. We see our colleagues to have OPD, to have their own hospital, to do their OT, and they stay in constant touch with patients. Important thing to remember is that it's a thankless job, and so patients would not recognize us when they are survived from broad dead or cardiac arrest and they shifted to ICU. Then we'll not see them. So patient would not recognize us, but definitely back of mind, we have in our mind that we have saved them, and because of our efforts, they are walking home safely. So the job prospects are very good. Now corporates are hiring in numbers, in bunches by the emergency physicians, and the recognition is going to be there. Each and every consultant would recognize you, each and every manager or the management person would recognize you, and you will be in touch from the junior most position of the hospital to the CEO of the hospital. So you will be in touch with CEO, you will be in touch with medical superintendent, you will be in touch with all quality managers, marketing department, operational heads, security, driver, everybody. So you will be the person who the whole hospital would be recognizing you as a doctor that would help us. So stay there and stay with bright future, and your bright future prospects are very good.
Thank you, sir. Thank you for enlightening us with this. Many residents or many interns that I know are skeptical about taking up emergency medicine, knowing that it's unearthly hours of work and not very rewarding at the end of the day. But your message to them will surely make them rethink, because it's such a emergency is so full of adrenaline and so rewarding at the end of the day. Ma'am, you've raised your hand.
Yes, I did, because I wanted to say a few things. I wanted to not to pass the message wrongly. It is not a thankless job. He only countered his own statement, saying that everyone will recognize you end of the day, including from security to the CEO of the hospital. So it is not a thankless job. Don't send the wrong message. That's what I wanted to say. Second thing, it is a revenue generating branch. We are actually maintenance department of the hospital. We are not production, but we are the maintenance department. If we don't do our job properly, the hospital is never going to get the good revenue. So revenue gets generated from ER, sending the patient straight to the ICU and OR. So yes, we are revenue generating as well. So that's all I wanted to say.
Okay, ma'am. Thank you, ma'am. Now moving on to our next round of questions. The first question will be to Dr. Sandeep Bore sir again. And the question is, where do we stand with respect to pre-hospital care delivery, and what is the scope of improvement, sir?
Okay, and I will just give some little bit clarification on what Harshil and Madam told, Reena Madam told. He said it's a very rewarding job. Mahatma Gandhi said, saving the life of a person is the most rewarding experience a person can undergo in his life. So we do that thing daily. So I think it's a highly rewarding job. In satisfaction and rewarding in emergency medicine is an instant satisfaction. If you give a shock and revert these things, arrhythmia, instant satisfaction. You lyse the patient with stroke, patient will get improved. You diagnose a proper pulmonary embolism, thrombolyze it, you will get a great satisfaction. So it's a very satisfying and satisfying job actually. And as Mahatma Gandhi said, it's rewarding also, because saving the life is an important thing. Now, to your current question is like that. What is the status of the pre-hospital medical services in India? Before answering this question, I would like to tell you two to three things first. We are a country of 1.5 billion people, huge country. Okay. Second thing, that emergency medicine has entered in this country in just 2 decades. We are now in that position when USA is in that position, exactly in the same position in 1980s. So early residencies happened, pre-hospital medical services are started. So we are in that services. Generally, pre-hospital medical services I saw in UK, at any part of the UK, within 12 minutes, ambulance go and reaches when you ask for help. Okay. UK is a country like Maharashtra. It's a small country. Okay. But in any part, when you ask for ambulance, you will get ambulance within 10 to 12 minutes. So to reach that distance, you can imagine if we have to go at that level, it's a very uphill task, but it's not impossible, because what we saw 20 years back, things has been tremendously changed. 20 years back, what is emergency medicine? Now every hospital. So that I will answer the previous question also, because they say that what is the job prospectus? Only one specialty doctors, means hospitals are nowadays very eager to hire, and that are the emergency medicine doctors. You go in market, you will have a vacancy everywhere. Any hospital, you will have emergency medicine doctor vacancy. So demand is very high and supply is very less, and you require some smartness to exploit the demand supply gap to remain in this healthcare profession. Again, this pre-hospital medical services, again little bit deviation was there, but pre-hospital medical services, it's now we can see the country has started with National Rural Health Mission, and due to that thing that 108 number is quite popularized, and I think in rural area also it was very heartening to see that you can get ambulance by calling 108. Yes, the time is little bit more, but I think in most of the parts of the country we will get this ambulance. But now ambulance will not save the life, only will not save life. You require well-equipped ambulance. So we have to work on the well-equipped ambulance also. Again, ambulance and well-equipped ambulance and equipments in ambulance will not save the lives. You require trained paramedical staff to take the patient from that particular patient in a scientific way and resuscitate that patient to the emergency department. So again, we have very less EMTs as compared to the Western countries. Again, less than 5% or 2% of EMTs are there as compared to the developed countries. So huge demand is there, and we have to increase the supply accordingly. To improve the pre-hospital health care services, one thing is required, as we have to give highest importance to the human life. These all Western countries, you can say the US, the UK, they have tremendous value for a human life. Their mindset is that every life matters. Similarly, that kind of mindset we have to inculcate in our healthcare delivery system, and we have to produce these kind of emergency medicine technicians there, and we have to invest in public healthcare. So there will be lots of and well-equipped ambulance. So after getting the well-equipped ambulance, paramedics, and bringing that patient to the hospital, most of these ambulance will go to the government hospital, rural hospital, as well as sub-district hospital or district hospital. So just taking that patient to the hospital is not enough. That hospital should be well equipped with equipments, infrastructure, and manpower to handle those emergencies. So pre-hospital medical services and emergency medicine, they are interconnected to each, and it's all about the chain of survival. Calling for the getting the patient from the ambulance, giving the oxygen and resuscitation in ambulance, and getting the proper care at the hospital in the emergency department there. So if all these chains we could bring together, then only we could able to save the lives. So definitely there is a big and huge scope and huge demand for the pre-hospital medical services in India. And as a nation, we have to travel miles and miles. And I'm hopeful that people are more and more aware about this emergency care, and they are become aware about this emergency medical facilities in Western countries also, and they know where exactly they are standing now. And as the public awareness will increase, then our government has to think about these things, and they have to increase the healthcare budget so that most of these they can invest into this public healthcare, and there will be the tremendous numbers of ambulances and EMTs as well as emergency medicine trained doctors and nurses will be available.
Thank you, sir. Thank you for emphasizing upon the need of a very proper pre-hospital care delivery system. Now coming to Dr. Deena Shah, ma'am, my question to you, ma'am, is how will community awareness regarding the emergency situations help us in strengthening the overall healthcare delivery system?
The most important people, I guess, is the community for us. And without community doing their job, we break the chain, what Dr. Sandeep was describing. The chain starts from the community, actually, where they identifying the signs, symptoms, calling an ambulance which is properly equipped, then ambulance taking it to the emergency department, and then comes ICU or neurosurgeon or neurologist and cardiologist and everyone. So yes, the knowing the first aid, knowing the emergency symptoms, signs, taking it to the specialty or super specialty hospital according to the signs and symptoms is very important. Community in our country, I would extend it to the medical community as well, not aware that when to do what. People who are working in healthcare industry, including our own staff, medical and paramedical staff, are also not aware what to do in certain emergency. They do panic, they call the special doctors whom they trust, and then they break the chain. So it is important to do that community beat. Working abroad, I realized that in those countries, they do train the kids from standard 7th for the first aid and CPR. So when they become the citizen, they are fully aware of signs and symptoms of emergency. They don't panic generally, and they bring the patient safely. They can give adrenaline pen injection if they develop allergy anaphylaxis. A lot they do in the community. They can do CPR. They can do on the sea also, they do CPR. So a lot can be done. When I do, that's why my interest was always in the first aid training and CPR. I still do a lot. Every week, almost 2 or 3 sessions, I still do with the community. And I feel it is very rewarding. 3 incidents of my own training people who has just attended for 1 hour, who has saved the life. One was in Paharganj railway station in Delhi. She used AED first time, knowing and seeing the AED on the demonstration of the first aid training. So yes, it is very easy. It is very, very life-saving for somebody's life who is the only breadwinner of the family. First aid and the role of the community is very, very important for all of us working in emergency department. And as a part of our job or our maintaining our own chain or getting the people safe to us, we should make the community aware that how important they are when they come in with a fracture, splinting it properly, slinging it properly, stopping the bleeding properly, or things like that. So it is very, very important to teach them those things. Operating AED kind of equipment, which is very simple, made for community, available now, government is putting it everywhere. So that also small things, small 5-10 minute session can teach them. So it is very important as a first aid teaching training to the community, which can add on to the outcome. So I would definitely put a very much importance in that first aid training of each and every family member. One person should be trained, and that person should keep teaching the next generation to generation, and then we can never lose a life which can be easily saved. So thank you.
Thank you, ma'am. Now you would emphasize on the point of CPR and its education. So reiterating upon that point, our next question to Dr. Shweta Tyagi, ma'am, is what are your comments, ma'am, regarding bystander CPR and the public education regarding the use of AED? Kindly elaborate more on that.
Yeah. So before I actually tell you anything about bystander CPR, let me highlight a little bit on the statistics. So the statistics which I could find was that sudden cardiac arrest actually accounts for 10% of overall mortality in our country. And if you see, the number of patients who actually receive bystander CPR is less than 1%. And there is no data available as of now about the use of AED, that how many patients have actually received AED or shock, and then they have been brought to the hospital. So definitely, we have a lot of potential here, a lot of opportunity here. As every adversity, this is a big opportunity for action. And if you say bystander CPR, it actually means a person who is right there at the time the person collapses. He is the one who is understanding that the person has collapsed, and he begins the chain of survival. So starting the chain of survival is early recognition and then calling for help and starting the chest compressions. So if you say bystander CPR, right now the guidelines are very clear that we need only compressions. So it is compressions only CPR. So there is no confusion regarding breathing, checking the pulse. So if a person has suddenly collapsed, you assume a cardiac arrest and you initiate chest compressions so that the circulation can be maintained till the medical team arrives. And once the medical team arrives, then they can take over. And if there is an availability of AED in the surroundings, then that can further pursue the chain of survival, that is early defibrillation. So immediate delivery of shock and early delivery of the shock can further increase the chances of survival of the patient by 2 to 3 folds. So every minute which passes by after the patient collapses, the chances of survival of this patient and the chances of and the morbidity and mortality of these patients, they are getting affected because of it. So yes, bystander CPR is really, really important. And I think few things which can be done so that as a country, we can empower our citizens to be, more knowledgeable, and the hesitancy of doing this bystander CPR can go away is definitely the way which Dr. Deena Shah said, that we need to increase the community awareness. So there have to be community CPR trainings, which can really help. Incorporating this in the schools, that is really a very, very important step. And if you are aware, actually National NMDA this has already taken this initiative of comprehensive school safety policy, which includes the training for first aid and basic life support in the high school. And that is one of the you have to show the skills to actually clear that test. So that is really, really good. And one child who learns that will definitely go back home and teach the rest of the family members, because children are so inquisitive, so enthusiastic. So once they learn it, they will make sure that the whole family knows that today in the school I have learned this, and this is what needs to be done if this happens. So this is really, really nice. And I think one more thing which can be done is it is happening, it needs to be reiterated, is the trainings which happen in the corporates. So they do call trained manpower to train them for basic life support and the basic first aid. So these trainings, when in any organization, changes are always, they come from top floor down. So I would say the high ups have to be really watchful about it and incorporate these trainings very thoughtfully to also not only train their employees, but also to empower them for the skill retention and the skill attrition, which will happen over the period of time once the training has happened. So these are important things I feel for bystander CPR. And one or two more things, like we have to ensure that the AEDs are available all across. Yes, we do see AEDs now in India. If you go to malls or theaters or airports, we do see AEDs. And as Dr. Deena said, they are really easy to use. It's just the hesitancy because people are not aware of what has to be done. So community awareness, I think that will have a very big role to play here.
Thank you, ma'am. Now our question to Dr. Harshil Mehta, sir, on how has our approach towards trauma changed from when we didn't have dedicated trauma centers to now when we do have dedicated trauma centers? Over to you, sir.
Change is drastically seen, and initially nobody was aware about ATLS protocols. ATLS, that is Advanced Trauma Life Support, that we all learned throughout our residency, and that is why it is important, where it is to be used, what are the equipment that an emergency department should have to manage trauma patients. These all things are changed. When I was a resident on the first day, I didn't see any kind of spinal board in my department. But gradually, when it develops, we had all the materials, all the equipments, all the medicines that is to be used in trauma patients. So now each and every department, the proper departments are having all spinal boards, cervical collar, and all the materials to be used in primary survey, secondary survey. And any trauma patient comes to emergency, it is a protocolized examination. That is the primary survey, then the adjuncts to primary survey, secondary survey, then the history and all those things. That is very structurally taken, and trauma sheets are also available in many corporates. So that trauma sheets are also having this structured approach. So even the first resident would not miss any step when they are treating any trauma patients. So trauma care has been improved a lot. And in trauma, we learned about golden hour, and there are 3 peaks of mortality. So these 3 peaks, the first peak we cannot avoid because it's the on-site trauma. But the second peak and third peak, where our care is important. And when we do give proper treatment in the first hour, in the golden hour, or in platinum minutes, then the second peak can be avoided, because if the patients are getting proper emergency care in a proper manner, in a proper way, then certainly the mortality rates can be reduced. The first and foremost thing that we should take care initially was not taken care is the airway and cervical spine. Generally, we see A, B, C, D, that means A means airway. But along with airway, there is another point, that is cervical spine stabilization. And many people who are not trained properly in trauma care, they miss the cervical spine stabilization. So these are the things, these are the minor things. Second thing is fast. As madam said, that we do fast in emergency, and we see whether patients are having any kind of free fluid in abdomen or not. If patients are having abdominal fluid, then we definitely see whether abdominal injuries are there or not. So these are all protocols, these are all policies that we follow. And in each policy, there are a lot of things to consider. Our spectrum should be very broad to cater any kind of trauma patients, the examination parts, the differential diagnosis. So these are all points that an emergency physicians are having in mind. If in emergency, if only physicians are working, or only surgeons are working, or only orthopedic surgeons are working, then they are having very pinpoint approach, or on only to their specific specialties. But it is the emergency physician, it is we are having the broad mind, we are having the broad spectrum, and that is why we can cater any injury from head injury to toe. So anything we can get in cater in emergency department, we can manage up to OT, anything that is been called to us. So because of emergency physicians, because of proper emergency department, trauma care has improved a lot. And because of that, patients are also getting prevented from any long-term morbidity and on-spot mortality. So that is where our role is. And I believe that each and every emergency physician should be trained for trauma support management. Over to you.
Thank you, sir. With this, we come to an end of our question and answer session. Now, if I may ask the audience or the participants, sir, you have something to say. You raised your hand.
Yeah. One point we missed, that rural emergency medicine. So rural emergency medicine has a lot of things to play. We get many patients from rural area, and where the treatments are not given in a proper way. And we feel that if certain kind of treatment should have been given, then the patient would be in a different shape. So for that, I believe that government has a lot of things to do. The NITI Aayog and NRHM and a lot of other agencies, those are running rural medical care, they have to do a lot of things regarding training, awareness, and the infrastructure. So if these three things are improved, then definitely our rural area where the maximum number of people are living in villages and they are having a different set of troubles, different set of problems, different set of diseases. Those diseases we don't see much in cities, in tier 1 cities, tier 2 cities. So for that, a different kind of model, a different kind of module to be set, and a different kind of training to be given on a regular basis, because their CHC, PHCs are there, their primary health centers are there, they are run by medical officers, there are nursing staffs over there. So now it's a time to include technology, it's time to include AI into the emergency medical care. And if those technologies, those devices, those instruments, it's a time to include into the emergency care, because everywhere doctor cannot reach, everywhere nursing staff cannot reach. And if doctors cannot reach or trained personnel cannot reach, then it's time to use those devices to give a proper care to patients in emergency system, situation, where if such treatments are given, then their further life, the morbidity is reduced on higher chances. So that is where from the JDA and IMA, I would like to propose to government to use or to improve the rural health and rural emergency medicine so that patients would have very bright chances for survival.
Thank you, sir. Thank you for emphasizing upon the need of rural like infrastructure building and the accessibility of primary healthcare in the rural areas. Now, the posters of this webinar were started circulating only yesterday, and yet we have had around 350 registrations for the event, and which is really great, showing how immensely interesting this topic of this field of emergency medicine is, and how young doctors and interns and residents are want to know more about this specialty. Now is the time to take questions from the viewers. So I have a few questions, mostly because we are attendance is from the JRs of the interns. So most of these are course related, curriculum related, or so one question is from Dr. Polami Lahiri. She asks that what is the prospect of after 1 year certificate course of emergency medicine? Anyone in the dais would like to take up the question?
Shall I answer? Yeah, emergency medicine, I think if somebody has to do a career in emergency medicine, I think I'm always emphasize that one should go for a 3-year full-time course. Emergency medicine cannot be learned in 1 year or some 6 months or 1.5 half years, because it's a very broad specialty. You have to see, you require a great clinical acumen, you require great clinical skills, as well as some astuteness has to come. A clinical astuteness has to come in the clinician to practice as an emergency medicine physician when he start his career. So I think 1 year course is not very much inadequate to get trained under emergency medicine. So I advise anybody who is looking for an emergency medicine career, I think they should opt for a 3-year full-time course, because emergency medicine cannot be learned in 1 year. Thank you.
Thank you, sir. Another question is also regarding a student's confusion. Dr. Jennifer Lilly asks, as an emergency medicine aspirant, I would like to ask about the best training institutes, and also, is the EM residency enough to replace anesthesia and ER? I am afraid because people around me discouraging me by saying that it's just an extended ACLS, ATLS, BLS program. Should it be rewarding in my career curve? So whoever wants to take up.
Shall I answer again?
I will take up this question, if it is fine. Okay. So, I mean, after all the discussion we have done through this entire webinar, saying that emergency medicine is only glorified ACLS, ATLS, BLS, I think that is the most understatement of the day. Okay, so it is definitely not that. It is way beyond. It is way beyond than only ATLS, BLS, and ACLS. That constitutes only a very small part of the emergency medicine. Maybe you can consider it as the tip of the iceberg. That tip is the one which gets seen, but below there is an entire strong foundation of, as Dr. Sandeep said, that the person who's working in the emergency department has to be completely aware of all the clinical specialties, right? From, you can have a patient ranging from a person with a high fever who's a medical oncology case on chemotherapy. So you're diagnosing febrile neutropenia at one end, and on the other end, you might have an acute stroke. So, your spectrum is wide. The criticality of situations you see are wide. So your communication, that plays a vital role. At one end, you will be counseling a patient's family, breaking the bad news that a person has suddenly died. And on the other hand, you will be counseling the patient on the relatives on, the patient will require ICU admission. So violent relatives, all of us have gone through, all aggressive relatives, their patient will have just, very minor problems, maybe just a little bit of cough or minor fever. So, being an emergency physician at various facets of communication, body language, to clinical expertise, to managing the entire situation. You're not only managing the patient, but you're managing the patient's families, you're managing the consultants who are on board with you, you're managing the management, and you are managing a lot of other paraclinical people. So I think this is how it should be. It's not only BLS, ATLS, and ACLS.
Yeah, I will again add in these things. A good emergency physician cannot be replaced by any other specialty. You require emergency medicine person only, because emergency medicine is a very different and unique specialty. You require clinical knowledge, you require best communication skill, you require socially, mentally, physically, and clinically fit to survive in this department. You have to talk to the you have to deal with the aggressive relatives. You have to do the counseling of the immediately diagnosed any irreversible head injury patients. So emergency physician, a good emergency physician is irreplaceable element, and that cannot be replaced by anything. And of course, it's not just extension of ATLS and BLS. It requires many more. Means you should be able to manage a status epilepticus better than any neurologist. You should be able to handle the acute coronary syndrome on a par with cardiologist. You should be the master of polytrauma resuscitation. At the same time, at the off OPD hours, you should be able to check out the OPD patients also. So emergency medicine, it encompasses all other specialties. It requires very big understanding of the subject and knowledge, as well as clinical acumen. And I think it's not just like the extension of the ATLS and BLS. ACLS and BLS cannot contain even 1% of the emergency medicine. So I think that is a misconception, and one should not carry forward with that particular misconceptions.
Thank you, sir. Two questions are on the same line. I would like to put them together. One is asked by Dr. Prithvi V and one is by Dr. Rahul Patni. The question is there any difference between MD and DNB emergency medicine, or are they equivalent? And another is, could you please suggest the best institutions for doing MD, DNB? I would want Dr. Harshil Mehta, sir, to answer this question. He could elaborate on it.
Yeah, so basically, MD and DNB emergency medicine, the course is same, the textbooks are same, the training is same. The MD is basically under this DNB is under NBE, that is National Board of Examination, and MD is under MCI, or now you can say NMC. So the only difference may be in getting a senior residency program in any government colleges who are having MD emergency medicine program. So the only difference is that otherwise the structure, the curriculum, the books, the exam pattern may be different, but in my opinion, both are safe. So if you are getting MD or DNB, you should not be confused. And you can have anyone, MD or DNB, both are almost equally same, except that the senior residency program, where the MD emergency medicine curriculum is there they are preferring MD emergency medicine as a senior resident. And after senior residency, you can go for assistant professor or associate professor. So for MD emergency program to go into associate or assistant professor, you need to have 1 year of residency program that is compulsory. And for that, MDs are preferred over DNBs. So that is the only difference that I can pursue, or clinically and practically, which is important. Otherwise, few differences or few minor differences are there. Those are not practically relevant.
Another question is there a geographical division with respect to emergency medicine in India, or is it equally distributed? Whoever wants to take it up. Deena ma'am.
I guess geographical distribution is always there. If we have seen our healthcare system, the way it evolves first, it develops first in south of our geographical distribution. And then slowly it come up and go on the sides. So every time it gets first implemented, executed, and slowly it opens up in other part of the country. This is what I have observed. I'm happy to have others comment. One point I want to add is there is not much to the previous question, not a difference in MD and DNB as such. It is for every single branch, there is MD and there is DNB. So whatever difference they are facing, that's the only difference you are facing in emergency medicine. There's nothing special which is different in emergency medicine. So you don't think that MD anesthesia and DNB anesthesia both are there. So it is same as emergency medicine, in emergency medicine as well.
Thank you, ma'am. One question comes from Dr. Aritra Bhattacharjee, asking how do we improve pre-hospital care? Like, though we have elaborated on it, but if someone would like to say, or
I guess the community care first, then the ambulance services to be streamlined, trained manpower, equipped manpower, establishing the paramedical system altogether, which is not there in our country, which is there in other countries. We still have to park the nurses and doctors in our ambulances. So establishing paramedical council as such is required, which is in long time in discussion in government sector. So hope someday they will improve the whole paramedical council, just say Medical Council of India, Nursing Council of India. Same way the paramedical council, which will take up the EMTs authorization to do certain things. Right now, even if we park EMTs, they are not authorized to give medicine. They are not authorized to operate on equipment, though they do, but it is not ethical. So those when the law changes, then only the things will change. Right now, to improve it as such, you do community training. You ensure that people you are parking in the ambulances, whosoever, are supposed to be at least nurses, and junior doctors should go if the cases are not sick. So something like that we can do, and we can improve on the thing. And the last bit, what Harshil said earlier, is using AI would be a game changer in especially the retrieval services as well. So we can bring it on into our emergency medical services, basically.
Thank you, ma'am. The next question is from Dr. Jennifer, asking, is there any opportunities for Indian EM docs to work abroad?
Yeah, but why they want to walk abroad? Indian emergency doctors are required
So
in,
do I.
in India.
Why should we go abroad?
Why
We
should we
have
go
got more
abroad?
than enough requirement in our
Yeah,
own country.
we are, yeah, Jennifer, we have great demand supply gap in India. We don't fulfill even 5% of required emergency medicine doctors. And why one want to go abroad in emergency to give emergency care there? But yes, on the other side, you can go there because emergency medicine is in huge demand in India, and it's huge demand in abroad also, in UK, Middle East. Every country they have a scarcity of emergency medicine, because emergency medicine is a specialty of the people, by the people, for the people. This specialty erupted by the demands of the people. So wherever the public demand is, it's for the people, because we realize that odd hours to give research to the acutely ill patient, senior doctors are not there, and who should be the who will take care of this patient? So on the basis of all these things, this specialty has erupted, and it encompasses all emergencies of all specialties. And that is the reason the demand, it's a relatively new specialty in all countries. So demand of emergency medicine doctors, well-trained emergency doctors, will be huge in India also, as well as abroad also. Once you clear certain exams like MRCM and all these things, people will run behind you to take a job in UK and other countries. But that is not the case. India requires well-trained emergency medicine department, and those who are undergoing training in emergency medicine, and those who want to pursue the emergency medicine as training, I request them, get well-trained and stay in India. Save and enrich the lives of the Indians, and that is our primary responsibility. And I think that should be mattering most to all of us at this stage and phase of life. Thank you.
Thank you, sir. Last question I'd be taking for today is by Dr. Swadesh Kumar. He asks that retrieving patients in emergency from peripheral areas in ambulances, patients are received in ill-equipped ambulances and by ill-trained manpower. Maybe he wants to ask what is the alternative, or what can be done in this regard.
What is the question? Let me read.
I'll take this partly. I will want to answer this. That yes, the pre-medical healthcare we have actually discussed quite a bit as our webinar has gone by. But again, to reiterate that pre-hospital care is one thing which requires a lot of effort, and a lot of effort means that it needs to come from the government agencies in terms of policy-driven changes, because this is something which, once the policies come in place, that is how it will translate into a change at the ground level. So there have been multiple things which have been done in the previous, say, 20 years. So earlier, ambulance meant just a vehicle which could transport the patient. But now, with the advent of 108 services, ambulances are available and are, even reaching the rural areas who are reasonably equipped, and they do have manpower. But then again, the training, how to monitor and audit whether they are how well trained they are. We also need to think about, as I previously said, all the skills undergo attrition. So what is the retention level of their skills? So that is again an important question to be answered. So there have been policies like, highways, they have toll numbers for emergency services. So if there is an accident at the highway, they will be immediately, the ambulance reaches and will take the patient to the nearest hospital for the first aid and the rest of the things. So yes, a lot of thing has happened over the previous 2 decades. But again, as Dr. Sandeep also said, it is a huge uphill task, and this will need to happen over the entire geographical boundary of the country. So it is a huge task, and it will definitely require a lot of effort from the government authorities and also from the entire medical fraternity, I would say. What Dr. Deena Shah also said was the EMT training that will also, the policies related to EMTs, they need to come as the mainstream for the pre-hospital care. All these things I think will definitely go a long way to make a great difference.
Thank you, ma'am. I'll just read out some of the comments from our attendees today. Just the positive comments and great work by Dr. Sarah Roberts, excellent program by Dr. Rejwan, happy EM Day to all by Dr. Gopal Chaturvedi, and amazing panelists, enlightening session. So here we would want to wrap up our today's webinar. It's been an eye-opener and enlightening for especially the residents, I guess, to have heard such words of wisdom from our esteemed seniors in the field who have had immense contribution in the field of emergency medicine in India and abroad. So before we end up the program, I would like to offer a vote of thanks. First and foremost, my extreme thanks to Indian Medical Association and Indian Medical Association Junior Doctors Network for giving me this platform, giving us this platform to host such an interactive and educative webinar. Second would be my thanks, sincerest thanks to Clearnet for giving us all the technical support last minute till 12 a.m. Yesterday, we were in a TESIL, Esther designing the poster, sending out registration link to the people. So thank you, Team Clearnet, for it. Then comes our esteemed speakers. I would like to thank each and all of you, all the 6 speakers that we've had. All of them have, we've put in the last moment request and they complied despite of being in their busy schedules and having so many commitments at hand. So this is really, we are really grateful, sirs and ma'ams, for giving us your valuable time, especially on this day, because we know all the emergency medicine departments today are overwhelmed with lots of programs, but you still gave us last minute confirmation. Thanks to that. And last but not the least, excellent audience. We've had around 350 registrations, mostly JRs and interns. And I would like to also congratulate all of them for having joined us. You will all be given an e-certificate for attending this session. So with this, I would like to conclude today's webinar. Thank you for joining, and happy Emergency Medicine Day to one and to all. Thank you.
Thank you. Thank you. Thank you.
Thank you very much.
Thank you, Rimi. You have been excellent too.
Thank you.
Happy Emergency Medicine Day to everybody.
Yeah.
Thank you. Yeah.